Hello, I'm Eunsoo Won, Professor of Psychiatry at Cha University and Chaum Life Center. Many of us have been influenced, not only physically, but mentally as well, by the COVID-19 pandemic. Patients who have been diagnosed and received hospital treatment, people who have been quarantined, family members of those who have passed away from the infection, medical personnel, and those who are financially struggling as a result of this pandemic have particularly been influenced. That's why today we'll be talking about mental health issues related to COVID-19. I'm here with Dr. Cho.
Hi, my name is Ara Cho, and I'm a clinical psychologist. I'll be asking Professor Won the most frequently asked questions regarding COVID-19 related mental health issues, which will provide useful information for those who are watching.
We're also going to show you a mindfulness breathing meditation technique at the end of this video, which is known to be helpful in alleviating COVID-19 related anxiety and depressive symptoms. You can simply follow us during the meditation and apply this technique to yourself. But first, we'll start with questions.
There are now more than 5.3 million cases of COVID-19 around the world and over 342,000 deaths and counting. The general public cannot help but feel anxious, as no one knows when this pandemic will end. What is the best way to deal with this kind of anxiety?
Anxiety itself is a normal reaction to a threatful situation. Our body's fight or flight response is being activated in order to break free from that situation and protect ourselves. Especially when a threatful situation is perceived as unpredictable, uncontrollable, and is chronically sustained, as in the current situation, your anxiety level goes up. So it's important to acknowledge that feeling a certain amount of anxiety is normal in this kind of situation, and it can be reassuring to know that you're not the only one who's feeling this way, and it's completely understandable. However, if your anxiety goes up to a point where it's harmful rather than protective, which means the anxiety itself is interfering with your everyday life, that's when you should become a little concerned. For instance, if your anxiety is keeping you from sleeping well, or you have a significant loss of appetite, or you're unable to sufficiently concentrate on your work, etc., this could mean that you may need some extra help with your anxiety.
Social distancing has now become globally commonplace as governments are making efforts to fight the continuing coronavirus outbreak. Although staying home and social distancing are proving to be effective in containing the spread of the virus, such circumstances are definitely taking a toll on the psychological health of the general public. Many say they are feeling lonely and isolated. How should we cope with the stress of the suddenly finding ourselves forced to adopt to a stay-at-home lifestyle due to social distancing and lockdown?
You can still remain actively social by maintaining regular contact through phone calls, emails, social media, etc. It's the physical contact that is prohibited, not the conversations that can be made. Also, for the extra time you have on your hands, set specific goals. Some call it social distancing or quarantine resolutions. Pick up on the things that you had postponed because you were too busy before. Now there's plenty of time. A sense of purpose during this difficult time will help you get through this somewhat devastating period. When you're spending most of your time at home, maintaining self-care is important. That is, get dressed, don't stay in your PJs all day. Some people tend to take showers more infrequently because they are working at home. If you feel physically clean and fresh, that will influence your state of mind in a positive way. Establish and maintain a steady daily routine, and although you're unable to control what's happening out there, try to take control of what's happening in your own space. This may lessen the sense of helplessness and boost the feeling of autonomy. Also, if you're just at home, there's a big possibility your sleep-wake cycle gets disrupted and meal times become irregular. Such disruptions in your circadian rhythm can worsen feelings of depression and anxiety, so try to keep it on track. Try to eat healthy. A lot of people are complaining of gaining weight, because they are snacking too much and obviously moving much less. Feeling heavier physically can also negatively influence your mood.
Although this is taking its toll on everyone's mental health, but it's particularly hard on those already living with conditions such as anxiety disorders, depressive disorders, and OCD. How can people with pre-existing psychiatric conditions deal with a pandemic situation like COVID-19?
As you've mentioned, patients with pre-existing depressive disorders, anxiety disorders such as panic disorder, obsessive-compulsive disorder, etc., are reporting that the symptoms have worsened. If you're a patient already receiving treatment, make sure you get your regular treatment, whether it's medication or psychotherapy. If you're physically unable to attend the appointment, carry out medical consultations through telepsychiatry, if possible. And make sure you maintain your treatment, as cessation of treatment will overtly worsen your symptoms. Also utilize the resources the government is offering you. For instance, in Korea, a national COVID-19 mental health support group is in operation, and community mental health centers have offered coronavirus disease-related services. Try to carry out activities that are known to alleviate symptoms of depression and anxiety, such as exercising or simple mindfulness meditation methods, which is a treatment meditation we are going to show you at the end of this video. Most importantly, actively reach out to your family and friends and explain in depth what you're going through. Just talking about it will really help.
Millions of people have been quarantined globally. What harm can 2 weeks of quarantine do to patients confirmed with COVID-19?
Well, on top of the confirmation itself, which is an extreme stress factor, overwhelming fear and anxiety that the symptoms may worsen have to be dealt with on your own due to the quarantine. Also, once someone is quarantined, their daily life has completely ground to a halt, which can be rather chaotic for some people. And the possibility of having passed on the infection to family members or at the workplace, etc., can be devastating, and often the quarantined person is wrongly blamed and can experience a strong sense of guilt. Also, the person may feel as if they have no control of the situation or have no autonomy, as they are physically confined to a specific area, which may contribute to the feelings of helplessness. Such an extremely stressful situation may lead to clinical symptoms of depression, anxiety, insomnia. Those who have recovered from the infection have expressed how hurtful it was to see hostile and angry online comments such as, "Don't come back to your place of residence," and start infecting those around you. I think a lot of the fear is transformed into anger and targeted to the wrong people.
What are the long-term psychological effects of being diagnosed with COVID-19 and hospitalization?
So for the long-term psychological effects on people who were infected with COVID-19 and had physical symptoms that were serious enough to be hospitalized, I consider it appropriate to make a comparison with MERS survivors. A previous study had reported that over 60% of Middle East respiratory syndrome survivors showed symptoms of post-traumatic stress disorder, sleep problems, anxiety, and depression after 1 year of survival. Survivors with a history of ventilator treatment, a family member who died from MERS, and a past psychiatric history were even reported to show higher suicidality and aggressiveness. Being diagnosed with an acutely life-threatening condition is a traumatic experience, especially receiving intensive care unit treatment, such as ventilators, can be experienced as extremely isolating and frightful for the patient. Also, infectious disease patients are even more isolated compared to other ICU patients due to precautionary measures. Survivors who had family members die of the same infection reported extreme guilt that they were the ones who had passed on the infection to the family member, which contributed to the profound sense of grief, anger, and suicidality. Although people who were infected are actually victims, they felt as if others saw them as perpetrators who spread the disease. Therefore, mental health care should be a part of the follow-up care for those who survived COVID-19.
What are the psychological effects of the prolonged COVID-19 situation on the public?
As we all know, anxiety and fear were the main psychological reactions at the very beginning of the COVID-19 situation, mainly targeted on the virus itself. For instance, how infectious and deadly is this virus? Can I or my family be infected? But on the other hand, there was this hope, this wishful thinking, that the extent of damage would not exceed that of the SARS or MERS, and the duration of the most acute and dangerous stage would be over soon. But it's become crystal clear that that's not the case. And on top of the domestic situation not being contained yet, COVID-19 has become a global pandemic. Now people are realizing that this is not a sprint. It's an extremely challenging and probably exhausting marathon. And although a hearty amount of anxiety is still focused on the physical threat the virus imposes on us, the anxiety now has broadened to the secondary effects of COVID-19. For instance, the economic burden. Countless people are losing their source of income and are questioning whether or not they will be able to financially survive this ongoing situation. But because there isn't much we can actually do, the feelings of helplessness and hopelessness are heavily building up, and this is steadily turning into anger. We've talked about the negative psychological influences social distancing can have on us. Although being a necessary process, it can really add on to the feelings of loneliness, isolation, and depression. And people are starting to feel exhausted and find it harder to keep up with the strict regulations that must be followed, such as social distancing. So if the initial reaction was more anxiety and fear, the feelings of hopelessness, helplessness, exhaustion, depression, and anger are catching up with the anxiety. That's probably why new words such as Corona Blue and Corona Apocalypse are being used.
If you're going through mental issues that are significant enough to interfere with your everyday life, for instance, if you're not sleeping well, or find it hard to concentrate on your work, or have problems interacting with the people around you, you should seek professional help.
Many treatment methods that are highly effective are available, so please do not hesitate to reach out if you feel as if you need help. One of the many powerful treatment methods for anxiety and depression is mindfulness-based cognitive therapy. Dr. Cho, please explain to us what mindfulness and mindfulness-based cognitive therapy is.
Mindfulness is continuously being aware of your current thoughts, feelings, and emotions, and can help change your attitude to be more present-oriented. This will help prevent you from being judgmental about your thoughts and accept yourself the way you are. Mindfulness-based cognitive therapy is a psychotherapy that uses cognitive behavior therapy methods in collaboration with mindfulness meditative practices. This is a powerful therapeutic tool that can be used to treat depression, anxiety, panic disorder, sleep disturbance, and other mental issues.
So among the many kinds of mindfulness-based meditation techniques, today Dr. Cho is going to show us the breathing technique, which is the most fundamental technique and convenient to conduct. If you have felt depressed or anxious about the current situation, or if you have had any sleeping problems or concentration difficulties recently, try this treatment meditation out. Just simply follow Dr. Cho's instructions.
If you're ready, please close your eyes. Find a relaxed, comfortable position, seated on a chair or on the floor on a cushion. Keep your back upright but not too stiff. Hands resting wherever they are comfortable. Tongue on the roof of your mouth or wherever is comfortable. And you can notice your body from the inside. noticing the shape of your body, the weight, touch, and let yourself relax and become curious about your body. Seated here, the sensations of your body, the connection with the chair, the floor. Relax any areas of tightness or tension. Just breathe, soften. And now, begin to tune into your breath in your body, feeling the natural flow of your breath. Don't need to do anything to your breath. Not long, not short, just natural. And notice where you feel your breath in your body. It might be in your stomach, it may be in your chest, or throat, or in your nostrils. See if you can feel the sensations of breath, one breath at a time. When one breath ends, the next breath begins. Now, as you do this, you might notice that your mind might start to wander. You might start thinking about other things. If this happens, this is not a problem. It's very natural. Just notice that your mind has wandered. Softly tell yourself that your mind is wandering. And then gently redirect your attention right back to the breathing. Now, you will stay with this for some time in silence, noticing your breath from time to time, getting lost in thought and returning to your breath. And once again, you can notice your body, your whole body seated here. Let yourself relax even more deeply. And then offer yourself some appreciation for doing this practice today, whatever that means to you. Finding a sense of ease and well-being for yourself and this day. You can now open your eyes.
Thank you so much. I hope our video today helps everyone overcome their anxiety and depression due to the current stressful situation related to the coronavirus. Everyone stay healthy and happy. Thank you.